Hi, everyone. DocTalk, another great week. From my dress, you can assume that the weather's getting cold. And in fact, it's Halloween week. Halloween is a great time to be in the fire service. We have a great opportunity this week to interact with the community, being a firefighter and around the kids. Man, that is the most natural part of our existence. This time of the year when we're still in the streets, doing really nice things in our community, interacting with them and keeping them safe. And it's the end of our fire prevention month, so we wrapped in some activities related to that. It's a great week. It's also a great week in this country because we're continuing to watch our COVID rates go down. So we're down significantly across a great deal of the country. For those of you in the northern tiers, still seeing some significant outbreaks and stretching of the health system. And so you still are in areas in this country and on this continent where COVID is still a big burden to the health system and people are dying. Our death rates within public safety are still over 3 people a day, and that's such a terrible toll in fire, EMS, and police and related law enforcement functions. God bless those of you that have suffered those losses in your departments, in your families, and in our community. All right, this week was the meeting in person of the American College of Emergency Physicians. We got to be together, and what a wonderful experience it is to be together and see people again. We were wearing masks in all the common areas and had to be tested, had to be able to show our vaccines and or show evidence of negative testing as part of the conference. But being together with other providers and talking about the issues of the day and how we're going to move forward, really a good time. Being in Boston, I got to see BFD equipment and Boston EMS and interact with them. And it's still wonderful what heritage we have in our fire EMS services. And it's great to see it in Boston. The talk of this week was overflowing emergency departments and how we're going to deal with that. So another new term, overflowing EDs, and whether it's COVID or other respiratory illnesses or other seasonal problems, things we talked about the past couple of weeks, like allergies. We are moving into a really busy time of the year, traditionally a busy time. And we always referred to Thanksgiving as the beginning of the season of death, and a disproportionate number of people that die this time of the year. That's always been shown in national statistics, and it's going to be showing again this year. So we're in a busy time and need to be prepared for it. How are we preparing right now? Well, the news on the disease is we are using conventional critical care treatment to get people through. We've added a couple of new steps. So you have heard in the news about monoclonal antibodies. You've heard about a new drug from Merck, molnupiravir. I still have a hard time getting through that pronunciation. You've heard about ivermectin and other treatments. So as of this week, we are still moving ahead with monoclonal antibody programs for those early in the symptomatic form of coronavirus. There's not enough of it to use in a prophylactic way in most communities, but this is something to talk to your medical director or your primary physician or your occupational medical group about treating yourself or treating members of your department if they have tested positive and are early in their symptoms. The Merck medication, and I'll refer to it as the Merck medication rather than try to struggle through that pronunciation again. The Merck medication does show some promise early in treatment, like other antivirals, that it may reduce the symptoms and reduce the impact of the virus. It is not as yet a cure for the virus. Ivermectin has not proven in any scientific studies so far to be beneficial. And like the other medicines that we thought might be useful throughout this last 18 months, ivermectin may end up in that treatment category as well. Let's talk about really important news, vaccinations. And this week, a couple of really good studies have been published. All right, one of them is that now we have had millions of people vaccinated, and across the planet, billions of people have been vaccinated, that they are finding that the vaccine reduces death rate, not only from coronavirus, but from other causes. That other causes probably relates to the fact that coronavirus, even if you don't have a full-blown horrible case, causes other changes in your body. One of them being that you get more coagulable, meaning that you're more prone to things like strokes and heart attacks, particularly in people at risk for that. So when they've looked at millions in populations, and the big study was done in Scotland, and said, compare those vaccinated with those unvaccinated, and what are the death rates? Over many, many months, they have found lower death rates in people who were vaccinated. So protection from coronavirus with the coronavirus vaccine is important, and it's important not only in prevention of coronavirus infection, but other causes of death as well. Another really important study, so important in our industry, so important. Hybrid immunity, new term for you to remember. Hybrid immunity is when you got the disease and then you got a vaccination. So that is hybrid immunity. So if you will, your body reacted to coronavirus by developing antibodies to it and other sources of protection for you. And if you supplement that with a vaccine on top of it, it has proven to be probably the best immunity that there is. We're not going to try to do that because getting the illness still is bad, and we're trying to prevent the illness altogether. But because a third of people in fire EMS have had the infection so far and are still making decisions about what they're going to do with the vaccination, I want you to know that the combination is important. Another reason it's important, another study this week says it appears your immunity after the disease wears out. And the wear out time so far has been about 16 months. So the best science says the people that were infected early, they have some antibodies and immunity. And remember, we were testing people early on for antibodies to see if they had had the disease, even though they may not have been aware of it. Or they did get sick and went through various treatments and tests, et cetera, and found that they had the disease. But it appears by the science that's available to us now that those people are apt to get infected again. And the period where that really begins to ramp up is 14 to 16 months after their original illness. And that still can be a dangerous illness, causing severe disease and death. Otherwise, the vaccine population has been seeing significantly reduced death and hospitalization rates. There are still people who have gotten sick after their vaccination series. It may be that their immune system just didn't get enough of a boost coming from the vaccines, and they were still at risk, or that they got an overwhelming amount of the virus, and even with a good immune system, it couldn't protect them from the illness. So what's happening now with the knowledge of that is we're trying to figure out if another boost shot is needed for everybody, and you're hearing now that it is. And we're working out this system now of giving either a second or a third vaccine. And this week, we've even heard about, for people with really weakened immune systems, that they may need another one. So a fourth one, even later on, 6 to 12 months down the line from their third one. So go back to the beginning here and say, vaccines still proving to be very effective across all three of our existing vaccines, and there will be a fourth and a fifth in coming months. We have now moved through the first FDA committee for approval down to age 5. So the Pfizer vaccine, probably the first 2 weeks of November, will be available and approved for use down to age 5. Those of you who have wanted this for your children or grandchildren, that pathway will be open. It will be at a new lower dose for the Pfizer vaccine than one given to adults. The Moderna vaccine is in the same process. It is now before the FDA in a reduced dose to give to children down to age 5. So that will be another piece to our opportunity to vaccinate. That has two implications for you. Number one, there's all these vaccines and now there's all these doses. And for you as an individual, you're like, where am I going to make my decision from? And then many of you are involved in programs where you're going to be looking at your people coming for vaccines because you're part of the vaccination staff. And so people coming in, they're going to say, hey, I want this vaccine and I think I want this dose. But tell me about the dose that I'm supposed to get of this vaccine. And so we are making a grid. And after the next couple of weeks, I got to tell you, we'll have our first audiovisual for DocTalk, and it will be about the decision grid and the dosage grid. And you're going to have one of these in front of you when you're on the vaccination staff, talking about the right dose for the right age, for whether it's the first or the second or the third dose, and what are the options that people are going to come in with. I had the J&J first. That's the particular group that has options later on. They want to get their second shot to be a Pfizer. What dose do you use for that? They want their second shot to be a Moderna. What dose do you use for that? You have 11 and 12-year-olds coming in. What's the correct dose? If we get that made into a grid to make life easy for you, both for getting it yourself and for administering it to others, we will be really, really ahead of the game in preparing the fire EMS force for it. As of right now, I want you to be aware, as policies are being written, full vaccination, quote unquote, full vaccination means you have received the primary series. As yet, full vaccination does not mandate the third vaccination of the Pfizer or Moderna or another vaccination on top of the J&J vaccine. That may change, and I think it will change over time. The same as for all of you who've been through and know about the hepatitis B vaccination, you have to wait for that 6-month shot to be considered fully vaccinated for hepatitis B. For now, many communities have moved through into the mandates for various vaccinations. Those mandates, just so you know, are for the primary series only. And mandates are a local issue, and very much you should be following what's going on in your local community regarding that. For now, we're still going to be in masks, and many of you, as you adapt your policies, you're still going to recognize that the incidence in your community is high, and we will be in masks for all of our public encounters and in common areas. As the incidence keeps coming down, especially locally, you may be able to come out of the masks in the stations and in certain public activities, but inside in a poorly ventilated area and where incidence is high, we're still going to be in masks. And then for most of us, we're still going to be for our patient encounters in N95s until the incidence gets very, very low and we understand more about protective immunity for the long term. We are at a great time in coming down the slope of this wave of COVID. The scientists around the world are still looking for signs that it's going to brew back again, that we're going to have another variant of concern, et cetera. But at this point, the combination of the vaccines that are available to us, the addition of getting children down to school age vaccinated will protect a whole lot more people at risk. And that's what we worry about most is the people at risk. And it protects all of you in your public encounters, which is what's so important to us, particularly as we head into what's the busy time of the year, both for the ambulance that's parked in our bay and for the engine. And the ladders and the rescues and everything else that we do. So another week of DocTalk. Please stay safe. Enjoy Halloween in your community as available. Consider the safety messages that still need to go out in our community, being part of the team. And thank you all for what you do. Have a great week.